I always think when I'm recording things, I used to kind of like have like a script and things, and now it's just all ad hoc because it's just it I just think it just hits better, you know. We could have had a chat for 5 minutes before this, and yeah, I think you lose the magic. I think you lose. I didn't realize you were a student. I thought you were qualified.
No, no, no. I wish.
Yeah.
I wish. I mean, I'm turning great, as you can see. So I'm
Yeah.
38 at the
Oh.
moment. So, yeah, yeah, yeah. So it's been a bit of a wild journey, to be fair with you. And I mean, I don't want to bore anyone who's watching or listening again, but because I've said it about 100 times over. But in essence, yeah, I've kind of travelled from Ukraine to Egypt, believe it
Right.
or not,
Yeah. Yeah.
and
Yeah.
then now currently in Slovakia. Yeah, so I'm currently in my fourth year, and this morning, for anybody who doesn't know, the electricity went out, didn't it? And I messaged you, and I was trying to send because I didn't want it to come across as though I was just like trying to flake. So there's
No,
me
not
taking
at
like
all.
videos with the
Yeah.
flash
Yeah.
on.
That's fine.
I'm really trying to work on this fuse box here. So yeah,
It's
no,
funny.
luckily we're gonna.
It's funny you say you're 38, because I qualified when I was 31. So my original plan was I joined the army as an engineer. In the UK, you can join as an apprentice. You do an apprenticeship in the British Army, and mine was tanks. So I did that from 16 to 22, and that's I got to the point where I was thinking, no, you know, I felt like I wanted to do something different. I felt like I was hitting my ceiling a little bit too early, and always wanted to be a dentist. I know that sounds mental, but someone asked me the other day why you want to be a dentist. But I think I had orthodontic treatment, and I was just sitting in the chair thinking, oh, this would be a nice little job, this. But so I left the army at 22, and then it took me 3 years. I had to go through night school, and and so I worked as a lorry driver during the day, and then I went to night school for about 4 days a week, doing my A levels, and then I think I joined. How old was I? I think I was 27 when I first started dental school. But it's been a bit like probably with you. You've probably been on a journey, haven't you? At 38.
But yeah, but I mean, I think yours sounds a little bit more cooler than mine. I'll be honest with you, especially with the whole tank thing and everything. But like,
Yeah,
I've got to ask you, like, the night school side of things, how do you stay motivated? I mean, for me, it was pretty easy, I think, because it was just a
yeah,
case of I went to uni, I did economics, I had a job, I made a bit of
yeah.
money. To be fair, my parents were quite supportive, but I had my A level sitting there. So when I wanted to take the decision to do dentistry, it was quite easy to do it abroad. But
Mm.
for somebody that has to kind of then re-motivate
So
yourself,
I tell you what happened is I we did a couple of tours of Iraq. If people don't know, with the British Army were in Iraq, rightly or wrongly, I'll say, and I came home and I just felt really deflated about the whole situation. I just felt like, what was I doing there? And I felt I just wasn't progressing, and I felt like I had. It sounds really arrogant, but I just feel like I wasn't hitting my peak. I feel like I wasn't getting the best out of myself. So I joined. I had a bit of money saved from when I came back from Iraq, and then I did an A level in biology as a distance learning course. I think
Mhm.
it's called ICS. Weirdly enough, ICS used to train engineers in the Wild West days on how to build trains and train tracks. And then from like 1870 whatever, they've come all this way, and then they've got like a massive company that they do GCSEs, A levels, all sorts of things. So I did this kind of distance learning thing where they'd send me work, I'd look through it, and then I would do like the work and then send it off. And then I did my A levels at
Right.
like a local school. So essentially, I just got a book and read A level biology, and you know, you ask me where was my like motivation to do that. It was fascinating
Oh,
learning about DNA and learning about all this stuff, and I was just absolutely captivated. So that essentially when I was in my late mid 20s, sorry, early to mid 20s, all my friends were going out, and I'd probably go for like a drink, or I'd go, you know, for a meal with them, and they'll be all saying, "Oh, you stay out," and I'd be like, "No, I've got to go home," and I'd read me books. And but so I think a lot of people, I suppose if you're a student and you're thinking to yourself, well, I'm kind of going from You know, this I'm a student now, and my life isn't really beginning until I'm a dentist. I disagree. I think that the kind of 10 years it took me from conception of being right, I want to be a dentist, to then
Yeah.
do my A levels and then do I see that as a really like great part of my life. I enjoyed my life then. It was interesting to learn, and I'll tell you now, if you come out of dental school, and you think your learning stops, it doesn't. I'm telling you, you'll just keep going and going and going, and it's a fantastic job. If you do see other dentists who they come out of dental school and then that's it. You know, that's they don't want to progress, and I think they're the dentists who hate the job. I think
Ah,
you can just learn. Even now, like I've been qualified 10 years, I'm still learning all the time, and it's fantastic. And
nice.
I've got friends who love it, and we talk, and you know, I it's probably uncool but I don't care. I think it's fascinating.
Yeah. I'll be honest with you. It's nice because I feel like I can resonate with you, which is really, really cool. Because maybe it's an age thing, maturity thing. I don't know. I don't want to just like
Yeah,
paint it
yeah,
in that
yeah,
way and say that anyone young is, not focused or whatever. Especially recently, I've like really, really fallen in love with dentistry, like to the
yeah,
point where I think maybe I had a bit of a turnaround in my mindset, whereby I was like, well, I'm doing it. Well, I might as well just enjoy it. Do you know? Like just
yeah.
take that kind of
How much
energy and direct
clinical
it.
how much clinical exposure have you got at the moment?
Fortunately, this year, so in our fourth year, so this is a 6 year course. So in our fourth year, it's kind of where it really starts. But
Yeah,
again, it's really down to, and I don't know whether you had the same experience when you were doing this, but it's genuinely down to how much you want it. Because a lot of the teachers that are working with you, they can sense it, can't they? They kind of like smell it,
yeah,
whether you're confident or want to try.
mm,
And then there's the other ones that just kind of just passively want to learn. So I think
yeah,
I put myself in positions where I'm like, right, I want to do it. Like there was literally a case today. So just as we were messaging, I finished a case today where it was quite a simple filling, really. Um, but I've put in the description about how I messed up because the first time I was using a retraction
yeah,
cord,
yeah,
right?
yeah, yeah,
But I'm kind of happy to do that, to really just
yeah.
dive in and say, well, look, I'll make the mistakes and go for it. But I'm sure was it? I mean, it's different in the UK, but was it similar in your sort of time?
I think I didn't shine very well at dental school. I think what happened with me is I probably peaked early because I did my A levels for non-British people. A levels is kind of like between high school and it's the stuff it's the exams you take to get into university.
That's it.
So I obviously worked full time as a lorry driver, and then I went to my life was just constantly this kind of grind. And then believe it or not, I left school with three GCSEs, and one of
What?
them was an A. So for any non-British people, that's a terrible. I basically left with nothing, and mainly because I just didn't. I don't know. I didn't have the kind of motivation for it back then. So when I did my A levels, I then tried to get into university, but I didn't have any GCSEs. So then I spent a year doing 10 GCSEs. So weirdly enough, I felt other than GCSE maths, that was something that was really needed to be. I had to go to college for that. It was difficult, but everything else was pretty much common sense or something I already knew. English as well was another one. Do you know, I was really proud of English because I left with two D's, I think, with English, and then when I went back to it to do it again, I got an A, and I was really proud of myself for that because I was not really confident about things like that. But yeah, I completely forgot I was talking about. But
We were just talking about kind of the experiences at the UK unis, especially in your time, in terms of like how much clinical work did you get? Is it the same kind of case of you've got to
no,
put yourself forward, or is it just they
so
throw work at you anyway?
I think I think as well, if you're a student, you got to be kind of realistic, haven't you? You know, I mean, I'm a private dentist now. I don't do NHS. I don't do government subsidized dentistry. And at my peak, I was seeing 30 people a day. And I was doing good quality dentistry. It wasn't like a kind of a sausage factory, as like we like to call it. It wasn't just like in and out, but it was a tough slog. So um, what I mean by that is when we were at university, we had the chance to, like, say in a session, which a session is like half a day, you could see
Right.
3 patients or you could see 1 patient. And I think the clinical tutors were like saying, just get 1 patient in and just get the basics right. I think some people want to they want to do everything. They want to get it all in, and they want to just do the really big stuff first. But I genuinely think if you just get the basics right first, that's really important. The problem with that advice is it's boring, isn't it? No one
Yeah.
wants to do that. You know what I mean? So um, the reason why I asked you about clinical time is in the UK, what happens is then once you've qualified your BDS, you then go into practice, but you have a year called vocational training where you have
Yeah.
like a mentor for a year, and that year essentially is what taught me how to be a dentist and how to. I remember going for our like you're sort of placed in regions, and then when you get to a region, then you have like an interview process with like 10 dentists, and 10 of you all sort of see how you fit. And I think my the thing I wanted to come across to these people, where these mentors, was I want to learn how to be a an NHS dentist. I don't. I want, obviously I want to learn the fun stuff, but
Yeah.
that, to me, that year was to just to learn how to do the job, because I think as soon as you learn how to do the job well, you can then kind of just sort of branch out and kind of like use your initiative and things like that. But again, I'll say it again, it's boring advice, but it's just so true. I said this in another podcast. You've got 30 years of your like your career to do
Yeah.
all these things. What's another year just to get it right?
So true.
Um,
I love that. I think that's like sometimes we skip to the future way too quick, and we think we're just running out of time. We
yeah,
just need to just slow it down. I think kind of like a microcosm of that is when you're sat there, even in your classes, and maybe they're a couple hours long, is taking that extra second, that extra minute just to do things. Because I feel as though maybe there's a pressure upon students. Maybe you felt it or you've seen it with students where we feel like we need to be like the professors that are teaching us, that we need to be quick and
yeah,
snappy and everything needs to be done. But it kind of goes back to the point you just made here, that it's all about the basics. And yes, it can
yeah,
be boring, but once you tap into those and get your principles nice and leveled off, it just becomes a better, there's the old saying, isn't it? It's like slow is smooth and smooth is fast kind of thing. And I
yeah,
think
yeah,
getting into that is something that requires you to understand the principles. But I guess my question then would be, how do we keep motivated, not only as students, but maybe newly qualified dentists,
yeah.
that when we're out there in the world and maybe we've got these time targets or people like our mentors asking us to do things slightly quicker, how do we just ensure that we can take that little breath, slow things down and get it done properly?
I just wonder. I mean, if you're asking me how to keep the sort of love of it, I think a lot of the time, and this is probably not helpful to say. I think it's within you. If you like me, I love efficiency and I love finding like processes to do things, and all that to me is like makes me really happy. And also I like root canal, obviously, and then I just leaned into that. So again, if you to our non-British listeners, with the government subsidised NHS, to do a root canal is not financially sort of it's not financially efficient for a dentist to do it. And yet on the NHS, I bought the microscope. By the way, I haven't put that there on purpose. It's just the way we did the rig, and I was like just flexing with a microscope.
It's a
So
bit of a fake background, so I'll take it.
I bought the microscope when I was still an NHS dentist,
Ah,
and it was like £200 a month or something. As soon as I got the microscope, oh my god, I was doing everything in the microscope. I was doing amalgams. I was doing. The thing is, when you look really close at the tooth, you just learn so much, and it's fascinating. So I got like a little bit obsessed with that. I at the moment I'm massively into AI. I don't know if you're doing any AI stuff at all.
I know a few things like Pearl AI, obviously, which is used. I also know about, because I've seen you've been on with Jazz recently, and I know he's a big advocate of like digital TCO as well, for example. So I think
You know
that the
what?
world. Go on.
You start seeing lots of patients, you will then realize how beneficial AI note taking is. This, by the way, is the AI generated stuff. But let me go to so this is me making a holiday request form for through ChatGPT for the kids at school. So I'm even using ChatGPT in my kind of just in my daily life. So this is Karuku. Let's go to a so they're all templates, yeah, but these templates are intuitive and they create something. So say I've got my Endo consult here. So if we click on this, and we can see this on the computer, can't we? Can
Yeah.
you see this?
So is this a specifically a dental AI program?
Yes, yeah, it's very
Okay.
specific to dental. So essentially, it's a button press and slight tapping. So again, what you'll notice when you start to do lots of notes, you will kind of do a lot of repetition. In
Yeah.
fact, let me actually go to filling one. This is better. So this is if I'm doing a normal filling. Okay. So my nurse can fill this out if she wants to. Me, personally, I'm quite I'm quite controlling over my notes. So this is going to create a note essentially. Essentially, let's just say we're doing a composite filling. So we press this button here, and I'm going
Oh,
to do a
nice.
composite. This then opens up something further down here. Say you've done it, it's an on upper right six. So this is we're going to do LA. I've pressed the infill button here, and then
No
do
way.
buckle upper right six,
No
and then
way. You're
I've
joking.
used one cartridge, this cartridge, and then say the tooth we've done today is the upper right six, moisture control. So you can either just use cotton wool or rubber dam. Say we play rubber dam, it opens up another thing. So I'll do single tooth isolation, no wedges or floss ties, all decay remove, yes. Depth of cavity. So if I press deep dent in here, it's going to open up
Yeah.
another thing where what liner I've used. So not required. Matrix system, so palette accessories that say no, and then different
No way.
bonding I've used. But the great thing about this is it's occlusion checked as well, so say it's fine. There's like a bit of a specific discussion. So if up here you've put that there's a deep dent in, you're going to say to the patient at the end, you're going to warn them, and this is kind of a bit of a warn. So the great thing is with if you press copy notes, and then if I get say I get this up. So if I paste
Got
this,
to interject here. I've got to interject here. But this is, I don't know why we as students don't get to see it, because this is like an idiot's guide to dentistry almost, isn't it?
why when I paste now, that's my clinical note.
Is
So
that enough for like clinical notes, like according to what's required in the
I think
UK?
so. So the thing is with these sorts of things is you ask a really really difficult question for me to answer, and I think really, when you get into practice, when you've qualified, you will see a wide range of how different dentists work. And I would say you just work the way you think is appropriate for you. So I know when I first started in my vocational training practice, everyone was great, everyone was fantastic, but they didn't do it the way they did in university. Like no one had any rubber dam. There was no rubber dam on with root canal on the NHS. But this was 10 years ago, and to me as a young dentist, I was like, right, I've got to do what they do because that's really how it's done. But then as you sort of grow and you think to yourself, you start to realize, and no, actually, you get your confidence. You think, no, actually, that I need to do it this way. So it's good that you look at other people, but it's also really important that you take your own responsibility on you and you do it the way you think. So to me, that's acceptable. I mean, my notes are crazy long. That I mean, I've just chosen a filling appointment there. My exam notes are crazy. But it's all bespoke, so it isn't. I suppose with these templates, some people like to type like a bit of a paragraph, but I think that is, I don't think that's valid. So this is why Karuku is absolutely fantastic. I would say though, there are many different note taking. You've got Heidi, and you've got Dan Dental Notes. There's loads, and like I say, this is what's exciting, isn't it? You kind of just you just try it, and if you like it, then use it, and then you can show other people if you're a bit boring, like me. And my principal here in Wrexham, I work in two other practices, but my principal here, he's 50 odd, and he still loves it. And I've shown him this digital TCO, and he thinks it's great, and we bounce off each other a little bit, and so it's this is I think we go back to the whole how do you stay happy with dentistry. To me, I love efficiency, and I love making things easier for myself. And when I find a new way of something, it's like it's nice, isn't it? And
Yeah.
the great thing about digital TCO is so the problem with AI is you never get a consistent result. So when you start to use AI, you'll always get a different answer, even if you ask the same question twice
That's it.
next to each other. So the problem with root canal specifically is that you need notes that are consistent, because when you go back to these notes, you're going to want to know where the information is, where you've put it, because if you're using a template, you can look back 5 years, and you'll go straight to the point where you're like, right, well, that was the working length, or oh, right, this is what I said about the tooth, it might become painful, and then the patient's back again. So there's that kind of thing. So but with AI, it's always different, so it's difficult to kind of filter through.
Think back to when you were a student, right? What could students be doing to increase their efficiency? Is there anything there that you could remember, like in hindsight?
I don't think I was a very good student. No. I, if I'm honest with myself, I probably didn't apply myself maybe as much as I could, and I think that's what I was talking about before. I
Yeah.
basically worked full time, and then every single night for 3 hours. I used to work, and then I got about 6 years in, so I did 2 years A levels, 1 year GCSE, another 3 years. I got to third year, and I just think I was burnt out. Also, as well, because I was a mature student, like yourself. I had to fund everything myself, so I basically just worked constantly at the weekends. I remember the best time to work for me was Friday, Saturday, Sunday. So I used to go to university on a Friday at like 9. We'd finish at 5, and then go straight to work, and I'll go straight through till 7 o'clock in the morning. I used to have for years, and now obviously I couldn't do that. But when you're 20, you love it, and it's. So I think I struggled slightly to really get a lot out of university, and I think now I when I qualified, I had the time, I had the money, and I really like came into my own. So I suppose if you're a student now and you feel like you're struggling and you're supporting yourself, just wait till you qualify. It'll get better for sure. But I mean, weirdly enough, I was quite analog as a student. So my sort of way of revising is I had these cue cards. If people don't know what a cue card is, they're about, I don't know, they're like 5 inches by, well, 8 inches by 3 inches, and I had a cue card on everything, everything. So, like, say it was whitening, and I'd use the little tiny thing, and then I'd have like this kind of box, and I'd have like these like little tabs up, and one would be like peds, one would be like ortho, and all that. And I'll never throw them away, because they're just, they're useless now, because they're old and they're probably wrong. But it's just such a huge part of my life, those cue cards. And then when I went into my finals, what I did is, as I flipped them round, and I had questions on the back, and
Uh-huh.
based on that, so I'd flip them round. But I mean, that's not very digital. I uh do a lot of mind mapping, and I know this sounds that
Okay.
sounds really crazy. So I've got this thing called Mind Node. Look at that. Do you know what? I feel like I'm going to be sharing this my screen again.
Uh,
Recent. So let's I tell you what, I recently did a Protrusive podcast, and you should check it out. It's a really, really good podcast.
I already have. I'm like
Mm,
literally whenever he drops an episode, I'm basically this is what I said earlier on. Like I've just said, you know what? Just embrace dentistry, man, and just become a geek. So Jazz has been a massive inspiration. And
Yeah.
before we segue into what you're about to show us, I have to give you a massive thank you and a shout out because recently you are my breakfast go-to video. So
Yes.
I'm like, I kid you
Again.
not, this is not just me saying it for the sake of it. I will sit there over breakfast and I watch your videos, and that's how I came across what you did, and that's why I reached out with you because I was like, this is ridiculous. You're making endo, which was for me probably like in terms of specialities at the bottom of the pile, and now I'm like, okay, no, this is actually super interesting. How can you take
It
something
is.
so damn small, right, and
Yeah.
intricate, and make it interesting? So when I watch your videos now, I'm like, it's
I
great. Like even the quality, I don't know what you're
I think
using.
it's fascinating.
Footage.
It's fascinating, and it isn't just when we talk about root canals that it isn't just filling. It's lots of things. And essentially, I think the reason why I went for root canal is because I kind of got obsessed with. I always think root canal is the kind of the specialty of toothache and saving the tooth, which was I have to say, by the way, I'm not a specialist in root canal. That's important for me to sort of be clear about. But it's kind of like the endodontics. And when I first qualified, I used to see loads of toothache, and I was fascinated by that. I was also fascinated by we'd get a patient in, and I didn't know if the tooth was savable. And I think endodontics is the specialty of that. I personally think it, about the pulp and things like that.
The way that I want to end this is with a fun little Q&A with you. So this is like quick fire. So
Sure.
I wanted to ask you some absolutely basic questions for you, but
Yeah.
for us students, this is like you give us like quick sentences for each one. So first one, what is an access cavity?
I would say an access cavity it's just basically a hole which is it's like an entrance to your root canal. And again, this could be a whole 3-hour chat. Hole, it's not. Anyway, next. Fascinated. It's fascinated. It's fascinating. Honest
Exactly.
to God. Uh,
But
anyway,
this
crack
this is
on.
this is why I've got to have you on again. So like
Yeah, yeah,
for
sure. I
now,
will. Will.
it's the quick fire, and then I'm whether you got time or not, I'm making it happen. So
Yeah, yeah.
next one, what is an accessory canal?
Again, I'm being really, really. It's accessory canal is a. I'm trying to put this into one sentence. It's essentially
Right.
it's just an extra canal which is either coming off a main canal, or it could be its own canal. The inside of the tooth is infinitely complex, and you could argue, does the accessory canal even exist?
Ah, I
Because
think this is.
it's so complicated inside. It's so complicated inside. It's kind of, how do you describe something? You could break it right down, but then it's not technically quite true, you know?
I'm with you. This is again. This is like a we're gonna have our own little mini series. I could just ask you each one, do a full topic on it. Um, I need to ask you what is the difference between a ledge and a perforation, if there is a difference.
Though there is definitely a difference. So a ledge is kind of like a kind of like little catch what your file is getting on. And so you go from a ledge. And then if you're pushing it onto a ledge even further, you're going to cause something called a transportation, which is like you're creating another canal or hole within the tooth just by your instruments. And then when the instrument breaches out of the end, so it causes a hole where a hole shouldn't be, that's a perforation.
Oh, so there was a step in between. So I didn't even know that. So
Yeah.
that's why I'm asking you these questions because they seem to be on the minds of students. Um, there's a couple more, and then I'll let you fly. There are there are a lot of liquids used in endodontics generally,
Mhm.
and I'm coming across hypochlorite. I've got calcium hydroxide. There's probably so many more, but those are like the ones that are always flying around, right? What are the typical, probably in university, let's just say, so we don't want to get too advanced there, sort of solutions that we should be aware of, and how do we use them in a quick way? If you could run us through that.
To cut a long story short, this is an easy question to answer. There's only three you need to worry about: sodium
Okay.
hypochlorite, um, EDTA,
Yep.
and non-certain calcium hydroxide. Everything else is just they're the things you're going to be using for root canal. Sodium hypochlorite is for irrigating the inside of the canal. Don't don't think chlorhexidine is safe. Again, another hour conversation. It's always sodium hypochlorite. EDTA is used as a final rinse because what happens is when you use your files within the canal space, you're creating a smear layer which is blocking all the dentinal tubules, and that can't be removed with sodium hypochlorite. So EDTA releases the smear layer and opens up the dental tubules, because remember, they're all little nooks and crannies where the bacteria can live, cause failure. And non-certain calcium hydroxide, maybe it's a bit controversial, but this is what you're going to be using as an intracanal medicament, meaning if a patient comes in pain and you open the tooth up, you can address it with that. If you're doing a root canal and you can't dry it, so you'll notice when you start doing root canals, it needs to be dry for you to do the obturation. You can address it with non-certain calcium hydroxide. I did my dissertation on non-certain calcium hydroxide. So again, it's yet another kind of, and this is the great thing about root canal. It's like a trunk of and it's got many different branches, and I think I'll never get to the end of every single branch, which is fantastic. Some people will have jobs where they'll hit their ceiling, but with dentistry it's just infinite, and you can just go down so many different paths. But that really is all you need to worry about. The main one is sodium hypochlorite, is bleach. You don't use anything else. Don't bother.
Nice stuff. Okay, and last two, real quick. In terms of, we only use hand files because we're not trusted enough with rotary instruments as yet. Is there a quick and easy way to know differences between that circle shape, square shape, triangle shape that you're probably sick of?
This is a really good answer. I don't know the answer to this question, because what you'll realize is you'll go into practice and you'll have a million and one different ways that the manufacturer will describe their file. What I would say is the quicker you can get to rotary or reciprocation files, the better. Hand files up to a certain point are terrible. That's my opinion. And do you know what? I went to university and we were allowed to use rotary files. Yeah, weren't allowed to. So I was taught the kind of shoulder technique where you kind of use the hand files to sort of step back, and it'll take you about 2 hours to do a root canal, which you could do in half an hour. Rotary files. I wouldn't advocate doing a root canal in half an hour, because
No.
I think probably the most important thing for you to understand with a root canal, it's not about the shaping, it's about the irrigation. So the
Okay.
shaping is not, people might think, well, we're scraping the inside of the canal out to get rid of the bacteria. Actually, the purpose of shaping is to create a pathway for your irrigant to flow. So we were talking about how the inside of the tooth is infinitely complex. Well, there's a really famous study where it says that only 30% of the ham file only touches 30% of the surface area inside the canal. So you're not really scraping anything. So what you need to get a good strong irrigant to kill the bacteria in. So I would move away from thinking about what diameter file we're going to be using, and what's important is the irrigant flow.
I'm with you. I'm with you. Okay, and then the final question, then I'll let you go. In the movie Finding Nemo, what file were they using? Because that's up for debate. So what's the real answer there?
I don't know what were they saying? What was
They were
the
going. The thing is, it's funny actually because I never noticed it being a dental student, but my brother-in-law mentioned it, and he said it's like a running joke within all dentists. But there's a scene where the girls or whoever it is, the kids getting like someone's getting an endo treatment, right? And Nemo finds himself
yeah.
in a fish tank for the
Well,
first time.
I think they mentioned Gates Glidden, don't they, at some point?
I have no idea. I've got to watch it
Yeah,
back. But I remember they
they
said an
mentioned
H
Gates.
file and an F file or something, and they were like,
They
"It's a this
mentioned
file because of this."
Gates Glidden at one point. And again, what I would say is I don't physically have Gates Glidden in my surgery, because it's too destructive of an instrument. And I think you're going to be ledging and you're transporting and perforating teeth more with a gated glide. And so that's my take on Finding Nemo.
Doc, it's been an absolute pleasure. Seriously, I think we've scratched the surface, and whenever time permits, we'll get you back on and dive in and maybe do a mini series.
Look forward to it. Have a good day.
Absolute ledge.
See you later.